It is 5 o'clock on Monday. I hope everybody had a good but also a very safe weekend. Now, as we move from that phase where we had to flatten the curve to save thousands of lives, to make sure our healthcare system was not overwhelmed, to where we are now, which is going to work, to be healthy at work, to develop the policies to where we can deal with this virus as we move forward. I hope that everybody is making sure that they are doing the right things to make sure that we can protect everybody out there as we move hopefully closer and closer to a vaccine at some point in the future. Let's start the way we always start, by remembering and by saying that we will get through this. We will get through this together. Say it with me. It's important every time. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. We're going to get through this together, especially in a big week this week, which is going to take us making sure that we do the right things. This Wednesday, we will have retail reopening at limited capacity, sure, but a lot of stores, a lot of shops that otherwise had been closed will be reopening on Wednesday. On Friday, we're going to have restaurants reopen all across Kentucky. And what I'm seeing is that they are working really hard to meet these new goals. And what I love hearing is that they are taking safety to be the utmost concern in thinking through it and thinking through their own physical setup in their restaurants. On Friday, a day we've waited for a long time, we're going to be able to get together in groups of 10 or less. We're going to talk all week long about how to do it safely. There's a way to do it that's not safe. There's a way to do it that is safer. And we want to make sure that we spend this week, all of us together, thinking through all the different ways that we can protect ourselves while seeing people for the first time in a while. And then while it has been allowed since a court ruling and since we put in guidance, a lot of houses of worship are going to open this weekend. So I know it is a big week for being healthy at work. So let's look at being healthy at work. Just like when we always talked about being healthy at home, we got to make sure that healthy at work is something that becomes a part of our muscle memory, something that becomes a part of everything we do, that we do these things without thinking. Because for the next however many months that we're going to have to get through, it's going to be really important that we do these so that we can be safe. So I'm going to just talk about enforcing social distancing today. It's really hard when people come back to work and you start feeling normalcy, to start wanting to get together, to not staying those 6 feet apart, being back in a setting that is comfortable where you didn't previously have to do that. I know from being here in the office, I'm not traveling the way that I have in the past, but once you have more people in, you want to do meetings the same way you did. Maybe everybody sit around that conference room table. Well, our table doesn't have 6 feet in between chairs, and we can't do that. So social distancing, really important in everything we do, in the way that we think about it, and in the way that our work setup is. And folks, take this seriously. We want to restart our economy. But if we don't do it right, if we don't wear the masks at work, if we sit right next to each other, if we don't follow these rules, then we cause the spike. And we harm our economy, not the virus, but us not doing what we know we need to do with the virus out there. So let's make sure that we continue to think through these and realize the best thing for our business is to be safe and to ensure that we are not the cause of an outbreak. We always talk about the rules, and then we talk about the next rule. Fill out your census. We are 13th in the country. I don't know if we've ever been 13th in the country on the census, but 13th has never been good enough, and I think that we can do so much better. We're holding firm in that place, but it's only 2% of the population. If they would get online and fill out their census, just take a couple of minutes, we would move up to 12th. So again, rebuilding is going to require a lot of federal dollars, and this is one way that we make sure that we get the federal dollars that everybody out there is competing for. So should we allow another state to take dollars that should be coming to us simply because we don't get online and fill out the census? I don't think so. So let's get this done. Let's make sure that we get our share of what's going to be paid out to states. All right, so in a lot of places, this is graduation week. And I know it's different and it's a little bit hard, but I tell you what, our graduates will never forget this graduation in the course of all the others that they have had or that they will have in their lives. I got to experience that a little with my son, who graduated from elementary school, but with a lot of schools doing graduation this week, we wanted to learn a little bit of sign language so that we could include absolutely everyone. So today's lesson is happy graduation. Okay, happy graduation. One more time. Happy graduation. And everybody out there, happy graduation. The circumstances of this virus do not diminish your accomplishment, and though they change the way that you have to go about it, I think it also changes us in ways that I hope will enrich each and every one of your lives. To remind us that compassion and kindness are critical, not just in who we are, but to our overall success as a Commonwealth and as a country. And that by letting the previous divisions go, by coming together, and by hopefully staying together, as many of us as we can, that we may have a brighter future, one where we can focus on the common good, and one where we can focus on moving our state forward and not fighting with each other in ways that we have seen. Maybe this graduation for you is that calling, is that recognition, and that we can be better moving ahead than we have been in the past. And for many of you, this is just going to be a memory. It's just going to be a memory in a long, rich life where you accomplished so much. So we are very excited for you. Before we move into our numbers today, I want to briefly mention former First Lady Phyllis George, and for a while Phyllis George Brown, a family friend of mine, a good friend to my mom, someone who contributed a lot to this state, especially the first major renovation of the governor's mansion in years, passed away after battling different complications for many years, leaves behind two children, Pamela and Lincoln, and a number of step kiddos too, and extended family. We're thinking about her also being a trailblazer, being one of the first women commentators in football, and having done just a lot to bring attention to this state, and always being involved, whether she was living here or not, being a really special part of it. And you know, while this is really before my time, I know that in the past that there were some issues between maybe Browns and Beshears. I think Phyllis George had a lot to do with being able to heal previous wounds and to really bring people together. And that's something special that you can say about somebody who can bring people together, even who may have in the past had very strong and serious emotions. So we're thinking about Phyllis. We're thinking about all of her family today. All right, our numbers throughout the weekend are lower than we had seen near the end of last week. But remember, what we always have is lower numbers come in on Sunday and on Monday, and then on Tuesday or Wednesday, a lot of them catch up. So for Sunday, we reported 122 new cases of COVID-19. And to give you an idea of where some of those were, 16-year-old female from Hardin, a 7-year-old boy from Bell, amongst others, just as a reminder that this can hit anywhere and anyone. Of the 122 cases for Sunday, 32 were in Jefferson, 12 were in Boone, 11 in Warren, 10 in Hardin and Kenton, 6 in Davis, 5 in Muhlenberg, 4 in McCracken, 3 in Fayette, 2 in Campbell, Fleming, Graves, Jessamine, Logan, Madison, and Menifee, and 1 in Adair, Allen, Bell, Boyd, Bullitt, Butler, Carroll, Clark, Fulton, Gallatin, Grayson, Hart, Oldham, Owen, and Shelby. And then on Sunday, we reported 3 new deaths, all 3 from Jefferson County, as are, I think, today's, and some of this is catching up with numbers that their health department had put out but hadn't been officially reported to us. A 68-year-old male from Jefferson, a 79-year-old male from Jefferson, and a 78-year-old male from Jefferson. And while we'll read today's numbers too, let's remember those are 3 families dealing with grief at a very difficult time, a time of heightened anxiety, and where we can't do things the way that we normally would that help us to deal with grief. So, light your houses up green. It's important every day. Every day it's important. Every day there are new families that need your help, and every day there are families that are still suffering. So let's remember to do it. Let's ring the bells at 10 a.m. Every morning. All right, for today's numbers, Mondays, and then I'll give the totals as they now exist. 138 new cases of COVID-19, and that brings our total cases to 7,935. 52 of those are probable. The rest are lab confirmed. And that is out of a total number of tests now, and this has gone up, dramatically over the last month, of 145,238. That's 145,238. Number ever hospitalized, 1,980. Currently 447. Ever in the ICU, 866. Currently in the ICU, 277. And that's a number that I'm watching. That's a number that we ought to be watching. I know there's actually a number of those that are from the federal prison in Lexington, but that's one that's gone up over the last several days, and we don't want to discount any of the reasons. We're continuing to look at that so that we can have the best information that we can have. And the total number of recovered, and this is a number that's done by a regional epidemiologist pretty high up the chain in their interviews and in days without symptoms, 2,785. So a number of new cases today also include some minors, and I think we're going to have that number together tomorrow just to give an idea. We're also going to go through and we're going to check on each of these kids as we go back in time that is tested positive. I want to know how they're all doing, especially with this new inflammatory syndrome. I think it's important for us to check in on them, just like we do our seniors on the other end. We had a 12-year-old girl from Fayette, a 17-year-old young man from Bullitt, a 12-year-old girl from Fayette. Just again, reinforcing that this happens all across Kentucky and to people of all different age groups. New cases by county for today's numbers: 26 in Boone, 25 in Warren, 19 in Jefferson, 18 in Kenton, 12 in Fayette, 4 in Bullitt and Madison, 3 in Anderson, Grant, Grayson, Henderson, and Logan, 2 in Hart and Ohio, and 1 in Adair, Bracken, Campbell, Christian, Davis, Nelson, Perry, Pulaski, Scott, Shelby, and Simpson. And then today, and while most of these are still catching up to numbers that had previously been released in Jefferson County, we're announcing 9 new Kentuckians that we have lost to the coronavirus, all 9 in Jefferson County. So from the state reporting, over the last 2 days, we've lost 12 Kentuckians, all from Jefferson County. They include a 50-year-old male, a 96-year-old male, a 102-year-old female, an 89, a 77, a 79, an 83, a 69, and a 76-year-old female, all from Jefferson County. So 12 Kentuckians altogether in the 2 days. Their families need your help. Let's make sure that we're there for them with those green lights, with that helping hand virtually over the phone. Let's make sure that we do what we always do in Kentucky, which is be a really good neighbor and look out for one another. When we look at race and ethnicity, based all the way through today's data. Of just total cases, 73.79% white, 14.79% black or African American, right about 6% Asian, 5.32% multiracial. And then the breakdown of ethnicity, that's 86.28% non-Hispanic and 13.72% Hispanic. On deaths, 77.1% white, 19.68% black or African American, 1.94% Asian, 1.29% multiracial. And then on deaths, this is creeping up just a little bit, 97.6% non-Hispanic and 2.4% Hispanic. Let's look very quickly at the long-term care facility numbers, which we track. Remember, this is 2 days' worth of data, 22 more residents, 19 more staff testing positive since Saturday, 2 more deaths attributable that we had previously announced, 3 new facilities having some tests. Look at that. That's over 1,000 residents, and that's important for us to note. Not to say this is where the virus is everywhere else, but to say how easy is it to spread to these facilities. So, every time that we go out without one of these, right? Could we, being asymptomatic, spread it to someone who works in one of these facilities? Because they could go to any of the places that we go to right now. So remember, we're not just our brother and sister's keeper that we know. We're our brother and sister's keeper for everybody across this state and really across this country, knowing that asymptomatic spread happens, and you'll never know exactly who it could possibly reach. But what you can do are all the steps to make sure you're not the one spreading it to other people. All right, we also today can announce, though we're not going to provide many details, that we have a third and a fourth child dealing with the COVID-related inflammatory syndrome. They are a 5-year-old who I believe went into the hospital on Saturday and is now home. We're very excited about that, and an 11-year-old that is currently hospitalized. So that means we had the initial 10-year-old who's still in the hospital, who's no longer intubated, but is still in the ICU. We have the teenager that was able to go home. We have this 5-year-old that was now able to go home, and we have an 11-year-old hospitalized. We're just watching this very carefully. It still appears to be very rare, but because it happens so many weeks or is suggested to happen so many weeks after an initial positive test or potential contraction of the virus, it's just really important for us to know what this is and to follow it very carefully. I'm going to ask Dr. Stack to comment on this, and then we are going to delve into contact tracing with a number of announcements there. So, Dr. Stack. Hold on just a second. Here we go.
Thank you, Governor. I have 2 issues to talk about at this time. The first is, yes, you can put that up, James, thanks. The first is about the syndrome we see in the children. I made a slide for you that you can see, and we'll try to tweet this out so people can see these symptoms and have that in other venues for you as well. So remember, if you have children, overwhelmingly the children do well. But we've had this concern, we've said it all along, that children still appear to get infected. They just seem to not have symptoms when they first get infected. We had hoped there wouldn't be problems for children, that they would do well, and it appears overwhelmingly they do well, but not all of them. And for those who get this syndrome, this is very serious. This is essentially a situation where weeks after the child would have gotten over the initial infection, their immune system becomes overactive and attacks the blood vessels in their own body and causes a number of problems that can involve the heart, the kidneys. You can have a rash. You can have fever because it's a body-wide inflammatory response, so you have a fever. You can have swelling in your hands and your feet because the little blood vessels, the capillaries, can leak, and that causes swelling in the far parts of the body, which are the hands and the feet. You can have abdominal pain. It can mimic things like appendicitis. If you have a child who has these symptoms, you should call or seek medical care. And obviously, if your child appears sick, you should seek medical care and take them to an emergency department if necessary. You can call the Kentucky COVID hotline, which you can find on the kycovid19.ky.gov website. You can call that phone number, and they will help you with questions and direct you if need be. It's also on the slides, 800-722-5725. So again, we'll try to share this out via social media tonight, so the slide's available for your information, and we'll share more information as we have it. The last thing I wanted to share at the governor's request was we are now ramping up very aggressively into testing long-term care facilities. And so we've been doing this for many weeks. We've been supporting nursing homes for quite a while, and it has consumed a fair amount of time and effort. This is our most vulnerable population in society because they are both confined in a nursing home and they are also elderly. In the United States, more than 80% of the deaths have been in people over 65 years of age. We are going to test 23 facilities this week is what we have planned, and if we should test close to 3,000 residents and staff members combined. So nearly 3,000 tests being done across 23 facilities. Actually it'll be more than that. Over the next 2 days alone, we'll test nearly 3,000 people. So we are going to go methodically over the next weeks to test nursing homes and to work with them to try to put in place plans to help keep these most vulnerable people among us safe. Thank you very much, Governor, and I'll be back a little bit later, I think.
All right, and you'd think the number of times that we've all done this together, I wouldn't miss things, but I did as we started out. I forgot that time where people around Kentucky show the types of behaviors, the type of actions that we need, that celebrate our successes, that help one another with our challenges, that recognize our anxieties, where we are there for each other, and where we can show people through social media that we are not alone. We use these hashtags, with the newest one being Healthy at Work, but I didn't want to forget this because the very first one I'm excited about. All right, this is Jerome. Jerome was in the ICU with COVID-19 for almost a month. 2 weeks of those, Jerome was on a ventilator. He praises God that he walked out of UK hospital on his own, no oxygen or even a walker. This is pretty exciting. This is somebody who has made what may even be a miraculous recovery. I'd like to think that that is both thanks to God and those he imbues with great skill in our hospital system. But Jerome, we are so excited for you. Thank you for sharing your story. These are the type of stories we need, especially as days drag on. All right. Again, this is talking about that very important thing that we need to be doing, which is wearing a mask. It's about protecting other people. I get that some people don't want to wear one, but it's not about you. It's about everybody else that you could be infecting. And we always see the stories about people who don't think they'll spread something and therefore don't take steps, and when they do, there's a profound guilt that may go along with it. Remember, you can't take that back once you've spread it in different places. So wear the mask. Look, you can monogram it, you can put different things on it, you can make your statement, whatever you want that statement to be. It's an opportunity to do something that's, again, just in the short term. But every single healthcare worker would tell you need to wear one, and everyone would say that if we're going back to work and increasing our contacts, this is a small thing that you can do to protect them. They're going to wear one when they treat you. Shouldn't we wear one not to spread it so that they're exposed to more? Now, let's just do the right thing. It's that simple. All right, so we've talked about houses of worship, and this is Plum Springs Baptist Church doing a thing that I think is really important, and that's educating the congregation. As we go back to anything, work, church, or anywhere else, this type of communication, this type of leadership that's being shown is really important. Just letting people know what's going to be different. So restaurants that are accepting reservations on Friday, Now, if you have the time, please talk through with people what they can expect and what they should expect, just how our new normal is going to be, and just for this period of time until we're totally through fighting this virus. Yeah, this is two special moments. This is this graduate visiting his grandmother, and of course the graduation itself. We should thank him and everybody else going through this for their sacrifice. It's what we're called to do in these times, and Kentuckians are stepping up to do it. All right, this is again our kids reaching out, thanking our healthcare workers, understanding exactly the sacrifice that's been made. And this is Munfordville. We see this all across Kentucky. Again, people being there for each other, lighting their homes, their city buildings, and everything else up green to make sure that people know that we are there for them. All right, today our in-depth discussion is going to be on contact tracing. Contact tracing, along with testing, is absolutely critical for our reopening and for being healthy at work. Today, we're going to talk a little bit about what it is. I'm going to introduce you to the leader that's going to help us through it. We're going to show you a video on what the reporting tools look like and what people should expect and what we need from you, the citizens of Kentucky, because it doesn't work without you buying in, without your voluntary commitment to making sure that we are safe as we reopen. So we're relying on more testing combined with better contact tracing by everybody to stop the spread of COVID-19. Contact tracing, which is funded through the CARES Act, dollars that are coming in from the federal government, is expanding to meet both the White House and my benchmarks for reopening. Remember, this is something that under the president's plan, he says we need to be doing. So when we're talking about calling you and you picking up, this isn't just me. This is the president, too. This is Democrats and Republicans, federal government, state government. This is just public health experts saying what's got to happen for us to have a safe reopening and to restart our economy without pausing it. This is an expanded 7-month contact tracing program that combines public participation and the power of technology to help public officials and healthcare providers contain the spread of this virus. The effort will help to best document COVID-positive Kentuckians and to quickly track those that have been in very close contact with them, ask them to self-isolate to prevent any further spread. It's how we identify it quickly and prevent it, one case from becoming 100 cases. Information provided is completely confidential, entirely, and we will be looking at every privacy concern out there from the technology piece to the other to respect it. Remember, this is something that we've done in the past. It's not new, and it's been done for some other communicable diseases that also require significant privacy and the trust of Kentuckians, and we can do this the same way. Public communications will help Kentuckians understand contact tracing and what to do if a public health worker contacts them. So Team Kentucky needs you. And what you're going to hear us say over and over is you need to answer the call. It's time for Kentuckians to answer the call of what it takes to defeat COVID-19 and the call that's going to come in to your cell phone or your landline. So today I'm pleased to announce that Mark Carter has joined the Office of the Secretary of the Cabinet for Health and Family Services as an executive advisor leading the contact tracing program. He'll work closely with Department of Public Health Commissioner Dr. Stephen Stack and the public health staff. Mark is a certified public accountant with 40 years' experience in the healthcare industry. Most recently, he was the Chief Executive Officer of Passport Health Plan, working with health professionals, working with stakeholders, and working with the community at large to build trust and to build networks that work and are effective. He's managed hundreds of people. He has worked with different interest groups out there, and I think is the right person to bring us all together and to lead this effort that is both organizational and is a big public affair and public buy-in process. Some more Before that, he was the CFO at Jewish Hospital and a partner with E&Y. Some more about Mark. He served as the president of Kentucky Healthcare Financial Management Association and a chair of the Foundation for a Healthy Kentucky. He's a graduate of UK, and he is an accomplished private pilot. He is a Kentuckian who has 3 adult children and 6 grandchildren. He knows what he's fighting for. So we're going to introduce Mark. He's going to walk through a number of things, show you a video. It's going to be really informative. And then we're going to ask Dr. Stack to talk about contact tracing as well. So let me introduce somebody we're really lucky to have. This type of experience you don't get for 7 months. This is him answering the call of what Kentuckians need. We are really, really fortunate. So here's Mark Carter.
Well, thank you, Governor. I wish my mother could have heard that introduction. I really do sincerely appreciate the opportunity to serve the Commonwealth in this capacity. I've long been an admirer of our State Department of Public Health and our local health departments and the work they do every day that is completely unsung, that the general public just doesn't really have a real appreciation for the work that they do to keep us protected. It's really heightened and become very important at a time like this when we face a pandemic like COVID-19. I know some of my friends are going to ask me why are you doing this? You know, you had a pretty nice life. I had sort of effectively retired, and I would say that the reason why, and Governor Beshear alluded to this, I have 6 grandchildren. We're going to need to reopen the economy. I completely agree with the efforts to do that. Too many people are hurting in terms of being unemployed and being challenged just to meet the daily needs of their families. So we have to reopen the economy, but we also have to protect our children, our families, our friends from another outbreak of COVID. One of the key ways to do that, in addition to effective and expanded testing that has been accomplished, is through a contact tracing program. I've got just a couple of slides, and I want to show you a video that I think do a pretty good job of explaining just what contact tracing really is. Governor Beshear has already commented about the objective, which is to contain the spread of COVID-19. We're basically doing that with an online tracking system that we're in the process of putting together currently. And, of course, the goal of it is to help people who have been exposed to COVID-19 deal with that exposure in a way that protects themselves and keeps the individual healthy, but also keeps them from infecting their family, friends, neighbors, and really other citizens, because we all have a responsibility to each other in this regard. I'm going to show you a video. It's about 3 minutes. I'll let you take a look at that, and then I'll have some concluding comments before I turn it back over to Dr. Stack.
To minimize the spread of COVID-19, public health workers need to know about exposures to make sure that all Kentuckians are safe and supported. We are using Kentucky's contact tracing and tracking system to help our disease investigators and contact tracers to gather the necessary information. Let us take the example of Sarah Smith, who is a disease investigator who starts her day by looking at a list of cases to act on. These cases are individuals who have tested positive for COVID-19. She picks up the case of Bobby Rim. Sarah reviews details about Bobby. She calls Bobby and begins the initial investigation. The system provides call scripts so disease investigators can be consistent with their messaging and make sure they do not miss any important information. Sarah confirms Bobby's symptoms, understands his needs around food, housing, and childcare, and finally, Sarah helps Bobby retrace his steps to document who he may have come in close contact with and which public settings he may have gone to while he was infectious. Among those people is Jan Johnson, who is Bobby's co-worker. Once the call is complete, Bobby is directed to isolate since he is positive for COVID-19. To assist Bobby in recovery, the system automatically sends an email with helpful information. Sarah follows up with Bobby daily to make sure Bobby is okay and address his needs if they have changed. Once Bobby recovers or is no longer infectious, the case for Bobby Rim is closed. Once investigation is complete, the information is handed off to a contact tracer. Contact tracers are public health workers. Contact tracers such as Fred notify individuals who may have come in contact with Bobby, such as Jan Johnson, who works with Bobby. Fred calls Jan and notifies her of potential exposure to a COVID-19 patient. Fred is provided a call script to assist in gathering information he needs from Jan. Fred confirms demographic information, asks Jan if she has been having any symptoms, and gathers basic medical history. Based on Jan's responses, the system sends a tailored email to Jan with helpful information. Fred follows up with Jan daily to check on her symptoms and understand her evolving needs for support should she start noticing symptoms. After Jan's exposure timeline has expired and she hasn't encountered any symptoms, she gets an automated return to work email. To protect patients' confidentiality, case contacts will not be told the identity of the person who may have reported them. They will be told what they need to do to care for themselves, reduce the risk to others, and protect their communities from any further exposure. Contact tracing and tracking combines public participation and the power of technology to help public health officials and private healthcare providers contain the spread of COVID-19.
Okay, thank you. I think that video is excellent in terms of explaining just what we're trying to accomplish here. Just to sum this up, before I turn it over to Dr. Stack, I never worked in an organization where a single individual made a real difference. Success is always based on teams. And so one of the things I always did in my previous roles was to make sure that I communicated to the team of what we needed from them to be successful. And so here what we're looking for in terms of the individual's role in contact tracing is to be aware that you could be contacted by a member of the public health department in your community or at the state level. Understand the importance of the process and answer the calls and really make sure you understand the instructions that you get and that you follow them. Be a messenger in your community. Spread the word so that other folks that would value your opinion, that you spread the word that this is a way that we can rebuild our economy and keep people safe and well. And then finally, keep an eye on the COVID-19 ky.gov website, as well as Governor Beshear's social media accounts for additional information as they come through. I've always been an optimist, and I know we can have it both ways. It's not a binary choice between reopening the economy and protecting people's health. We can do both, but we need to do it together. You'll get my best effort at doing that. Thank you.
Thank you very much, Mark, and thank you, Governor. This is a wonderful addition to our team to have Mark Carter join us. So we're going to hire in the ballpark of, we hope, 700 additional people, give or take a little bit. And we're going to have an enormous increase in workforce that we are going to have to deploy very effectively to help perform this contact tracing at a scale that we've never done before, at least not to my knowledge in the state and kind of across the nation. They're going to be doing the same things. I'd like to emphasize some things for why this is so absolutely important. So while Mark and the rest of our team at Kentucky Department for Public Health and in partnership with the local health departments are going to work very, very hard to try to identify everybody who is infected and try to reach out to them, to try to help identify people that could have been exposed secondarily, and to try to contain the infection, none of this will work without your partnership. This is absolutely important. Contact tracing is the way we get back as much as possible to what normal used to be like. Contact tracing is the way we act very quickly to localize infection, keep it from spreading, and enable us to get back to interacting with each other as much as we can. Social distancing, masking, improved hygiene with washing your hands and covering your cough and sneeze, those things are with us for well over the next year or two, and they really should never go away, some of them. We should always cover our cough and our sneeze and wash our hands and be careful when we have infection. but this extra attention to it is going to be absolutely essential. The contact tracing, though, is what we have to do when, despite all of our best efforts at those things, infection still occurs and infection is still a risk to spread. So remember, the predictions that we saw months ago when we started this would have suggested we could have had tens of thousands of Kentuckians dying right now. And because of your hard work, because of your sacrifice and your success, Team Kentucky came together, and though we've suffered losses, they are not anywhere near the magnitude they could have been. The steps we take now to improve testing, to identify people with infection, and to work with you and requiring your partnership to identify infection and isolate it quickly is what's going to help us to get back to normal as quickly as possible and restore us all to the things that we have missed doing so much in the last couple of months. So I welcome Mark to the team. I'm grateful for the resource, and thank you, Governor, for helping to increase our bench strength so that we can get through this and get through it together. Thank you.
Thank you. So again, contact tracing. You see our leadership, our team is filling out. It's going to become a critical part of what we're doing moving forward, but the team includes you. This only works if the citizens of Kentucky know that it is our obligation to protect one another and that this is our new phase, to make sure that when we have a case, we can contain it, and therefore we can move forward with our reopening and we can reach that new normal. So I need you to answer the call. That is going to be what we have to do moving forward. And we'll be addressing and ensuring that everybody's privacy is protected. I was on a panel this weekend with everybody from Bob Woodward to the public health head of New Zealand, but also to the head of Human Rights Watch in Europe for the worldwide. And it's not an either or when you look at privacy. He was specifically talking about different tools to use and the ones that protected it well and then the ones that don't. We're going to make sure that we do this right because we got to have your trust. It's something that I hope I've earned trying to make the good decisions, and we will protect you moving forward and your privacy, but we need you to answer the call. It's the only way that we do this safely. So, tracing is effective with robust testing. And as we sit here today, we are finally at a point where we have robust testing. If you'll pull up testing all across the state, it grows every week. I mean, I remember when we were working, we worked 3 weeks to get our first drive-through testing site up because of a lack of PPE and a lack of swabs. Couple months ago, and look at where we are now. And we add some every week. I want to point out Bell County, Pineville Community Health Center, stepping up and now providing drive-through COVID-19 testing beginning this Wednesday, May 20th, from 11 a.m. to 5 p.m. This will bring the first drive-through testing to Bell County. I also don't think we've had it in Harlan next door. Let's make sure that we take advantage of it. So when you look at this map, we finally have what we had wanted. We have the ability for everybody who wants to get tested to get tested. But now we need you to do it. To do this right, we need to be testing over 2% of our population every month. I'd like to get that up closer to 4%. That's going to take everybody wanting and agreeing and going out to get a test. And it's going to take people periodically getting retested. And just look at that. If you look at that map, there is a testing location near you or pretty close to you, no matter where you are in Kentucky. So we need you to get tested. And I want to look over just our Kroger numbers, if you'll put up how to sign up for this week. Again, this is our highest volume drive-through testing. And I want to say in Louisville, we're doing a pretty good job. Today, I think we had 315 people tested by 4 o'clock, which means I think we'll get close to the 400 today. And tomorrow on Tuesday, we got a full 400 signed up. We got about 20 more spots on Wednesday, but then Thursday and Friday, about 300 apiece. So, Louisville area, get online. That means there's, about 620 spots available Wednesday, Thursday, and Friday. Again, this is the largest city in the state. It's where the most cases are because there's the most population. This helps Jefferson County, the city of Louisville, and the surrounding counties better address COVID-19. Please sign up to get tested. All right, Richmond is starting off really well on Tuesday with 404, which is the total. But then on Wednesday, about another 200, and then on Thursday, another 300 spots available. Again, Richmond area. We haven't had testing directly in your area. We need you to sign up. We ought to get all these done. And then we did two in areas that have been hard hit in western Kentucky, in Ohio County and in Graves County. So in Ohio County right now, our first day Tuesday, we only have 87 people signed up. Folks, if we're going to combat this, if we're going to reopen our economy in these areas, we got to do better than that. So we need at least 300 people to go online today to sign up for a test tomorrow. If you go online right now, you can probably get tested in Ohio County tomorrow. Wednesday, we only have 45 people signed up, 350 spots there. Thursday, we have 13 people signed up, right? So 477, 480, well, I'm not going to do math today. That's 487 spots left. And so let's make sure, oh no, that was 11 and Graves has 13. Graves County the same. Graves County on Tuesday, only 136 people signed up. Again, close to 300 spots available. On Wednesday and on Thursday combined, just over 55. So there is a huge amount of testing available. The kits are there. The people are ready. So let's make sure in western Kentucky, in either the Ohio County or the Graves County area, we get signed up. The way that we're able to move these sites around to different parts of Kentucky only works if we have people come through and get tested. Testing and tracing is what makes us safe as we're reopening. We got to make sure that both of them happen. Again, it's part of our duties as citizens, but I believe we can do this with everything we've done thus far, with plateauing the curve, with protecting one another. Let's just continue to do it in this new way. All right, let's move into questions. We have 4 journalists with us. We have Karen Czar, Phil Pendleton, Joe Sonka, and Catherine Collins. And then we have several from home. But let's start off with Joe. Welcome back.
So what is the process with the RFP on contact tracers? Has that been awarded yet? Is Carter's position at all related to whoever's won that?
So the RFP out for contact tracing, and that builds the Corps and kind of the ground troops that are going to be doing it, has been awarded, and there are multiple awards around the state. What that lets us do is hire from multiple different groups that can let us be regional if necessary in where we go and how we do it. We believe it gives us additional flexibility. So Mark is working with those contracts right now to decide the exact numbers from each side. We're going to be training people this week. We're going to be training people next week. It won't all happen at once. We won't have 700 immediately, but our goal is especially in the next 2 weeks to really get ramped up. So it's not just one award. It's multiple awards that we can pull from. Some say that asymptomatic people shouldn't bother being tested for COVID-19 or antibodies because they could be exposed the next day and if they are around other people. What do you say to people, and should everyone be tested regardless of being symptomatic? Yes. If you are feeling well, but we have testing sites in your area, you need to get tested. Get tested before you go back to work. Get tested to make sure that you're not, you don't have it and potentially exposing your kids. Get tested so you don't go to the grocery store when you might know that you have it. We need this both to contain the virus because we're going to need to know when people are asymptomatic because that's when you spread it the most. If you're symptomatic, hopefully you're staying in your house or you're going to the hospital if you need to. You're not out there. So to reduce the spread, we need to find those asymptomatic people. The other thing we need to know is what's the infection rate that's asymptomatic. Without getting tested, we don't know how many people out there actually have it. So it's important for data, for public health, and it's also important to protect people. Phil.
With restaurants reopening this week, the capacity was 33%. What data did you all get that 33% capacity from?
Questions on restaurants opening, the 33%, what do we use to get there? Different states have done different things. Some people aren't reopening their restaurants at all right now. Florida initially opened at 25% and outside seating. Others opened at 50%. I don't think anybody went all the way right at the beginning. We made our decision based on the number of cases that we had, based on the timing and the ability to prepare for it, and based on the best science that we have available in trying to get this started, but at the same time to keep cases low. I also believe in doing things gradually. It's the way we ultimately had our restrictions. Some states said, everybody go home, and nobody come out. And they did it, they waited longer. But what we did is we stepped into it. And I think it's really important. For me, can you put up the Healthy at Work? For me, the reason that I believe we've done so well is Healthy at Home became a part of what I call our muscle memory. This gives us time to make sure that this is part of our muscle memory too. If we throw too much new normal at everyone all at once, it's very difficult for us to do the things that we need to. But if we step into it and it gives us an opportunity, then I believe that we can be safer. It also gives us a little bit of extra time to see what's happening in other states, which we're watching very carefully. With Lake Barkley and Lake Cumberland continuing to remain closed to house low acuity patients, how will the state assist them in recovering lost revenue? And will the state help out county governments who rely on them as part of transient tax revenue? What we are keeping them closed at the moment for is knowing that we have had, especially in that area, a number of senior living facilities where we have had outbreaks, where there may be a need to move people to low acuity where they don't need to be in a hospital. But with many of the facilities not being able to have COVID wings, we have seen the need to do that. We've also had to house different individuals there. And we're not going to keep the two closed any longer than they need to, but there will be reimbursement to those facilities, mainly through the state, which operates those two facilities to ensure that they are made whole. We are making $300 million available in an initial round of CARES Act funding to cities and counties to help in any way we can, but that money can't be used, and we can't provide direct money just for lost revenue right now. The federal government isn't allowing us to do that, and that's why that previous CARES Act money can't fix our budget problems. They basically said it's only for these set things, and it can be a little bit of help for the state police, for example, it can help with, but without direct budgetary relief through another CARES Act bill, these counties can't be helped for the lost revenue, and the state can't be helped for the lost revenue. Karen.
Governor, I understand with the contact tracing, for example, if someone in this room today tested positive, tomorrow we know who was in this room. How will you handle locating and informing people in a broader sense? For example, you went to a retail store and someone who works there tested positive. How will you inform people who are in the store?
Well, contact tracing isn't exact in many ways. It relies on proximity, how close that you have been and what type of contact you had with the person who's tested positive, and duration of that. We have seen very little spread in what we would call a transient activity like going to the grocery store. If you're doing it right and you're not stopping to talk to people, you're moving past each other pretty quickly. And if you're doing it right in the grocery store, you're not in there for an hour during this outbreak. And so we don't see a lot of that. But take the choir that we had. They were together in close proximity for a couple of hours. And so when people get the call that they were in contact, what they're going to be asked to do is going to depend on their level, both their proximity and the duration that they were with. So you may get a call saying, we need you to self-quarantine. You had direct contact, long enough exposure, presents a risk. This is what we need you to do as a citizen. But you also may get a call saying that you are in a general area with somebody, monitor your symptoms, go get tested. you have a very low risk, but you need to know. And so there's going to be a range when people are talked to about it, and there's going to be testing options out there for it. Now, part of when these happen in establishments are going to rely on the establishments giving us as much information as they can so we can reach out to people. If we have to put out there that in store X or in restaurant Y, we had a positive test during these hours, and with the facility we can't identify who was there, then we may have to make a more public statement. And I know nobody wants that when they're that business. We'll only do it if we have to for public health. But I hope it just makes everybody more committed to doing the right thing. And there'll be instances where it happens, and we may have to publicize it for public health that has nothing to do with the institution itself, and they could all be doing the right thing. This thing just spreads aggressively. I answered how we do the recovery information. How will the state staff and pay for extensive contact tracing? This is with the CARES Act money. Between this and testing, I think we'll spend well over $100 million of the $1.6 billion. Now that's state and local governments will get a share of that too, and it'll go a lot of other places. But the CARES Act money, and I don't want to suggest it's not absolutely critical that we've received. It is for many things. It can't be applied to our general budget, so it doesn't solve that issue where we're going to face a longer recession unless Washington acts in a way like they did under the Great Recession. But the CARES Act money is really helpful for contact tracing and testing. It is helpful for safely reopening our economy. Catherine, thank you for waiting.
Can you talk about the decision on the 7-month time period here, and if maybe that's on the contact tracing, if that might need to be extended?
So the 7-month is based on the amount of time we have the CARES Act funding for. It all depends on where a vaccine or treatment is. It may well need to be extended. And if we're still in this, I do believe the federal government will step up and extend the period of time that we can use that CARES Act money for. Now, what we're also going to want is, if we're going to be dealing with this longer than the new year, I know the White House is putting a big push and has been putting a lot of pressure towards the vaccine, then contact tracing is going to be something that we all also are going to have to learn how to do in institutions, places of business. Universities are actually stepping up right now to learn as much as they can. All right, we have a lot of questions coming in about malls. All right, so we can provide clarification tonight that malls may reopen on May 20th if and only if they can meet the retail requirements. That means that the mall itself, entrances and exits, have to maintain the occupancy of 33%, and that is separate from in any store inside of the mall that also has to do it. That also means that you have to meet the requirements for cleaning, and you got a lot of place and a lot of surfaces to clean. And then anything inside the food court has to meet the restaurant requirements as they are on May the 22nd. So I know there's a lot there, but there's guidance up. It's on kycovid19.ky.gov. It took us a little longer to get here, so do those organizations. And we apologize for that, but we're going to treat you the same as everybody else, though. I know a mall creates some additional steps, given that there are also the facilities inside. We'll go back around. Joe?
So, is the state at all tracking what percentage of positive cases are asymptomatic? And is that an important statistic for the state to have and for the public to
The question is, are we tracking the number of cases that are asymptomatic as opposed to symptomatic? The tough part there is actually getting the good information from people. I think the way that we would compare it right now is the drive-through testing that we have, especially the Kroger, is primarily used by asymptomatic folks. Most of the time, symptomatic folks will go directly to a hospital for that testing. And so we're finding about a 1% rate on the Kroger testing, which right now we think is probably a good estimate of the asymptomatic rate, unless Steve starts disagreeing with me. And then we're finding about a 5%, or we had, it's a little bit below that rate on the other. Steve, you want to weigh in on that as well? This is, people have heard this before, where he corrects me.
No, if anything, Governor, I continue to be impressed at how accurately you get most of these statistics. So when we do the Kroger drive-through, like you said, it's not perfect, but that's probably a decent community sampling. We move around the state and go to different places, and we have a positivity rate of about 1% to 2%, and that's been pretty consistent over the last couple of weeks. If we were to go into a community where there's increased infection, we would expect it to go up a little bit and go down in other areas where there's not as much infection, but it's still relatively low there. When we go into a nursing home or a prison where we know that the infection rate is higher, the positivity rate can go up in the double digits, in the low teens or mid-teens, but that's where we've used our judgment, and we go in specifically looking for the disease, and so that's higher. There was a study that was done in Indiana, and you may have seen that, where they did 4,600 patients or individuals scattered throughout the state and tried to figure out what the disease, what they call prevalence, was, and they estimated it was probably around 3%, give or take a little bit. Those studies are things that we consider. I think we need to do it a little bit later, because when the prevalence in the community is relatively low, the antibody testing, which is a part of that kind of study, the false positive rate can skew the results. So I think we'll look at whether those are options as we get further into the summer, whether that's helpful or not. But for right now, I see a range anywhere from, I'm rounding, 15% to 30% for asymptomatic. And so I've generally quoted about 1 in 4 people could be asymptomatic with the disease. A longer answer, but more detail and substance. Thanks.
All right. Question here about how much of an issue is it of people maybe not being willing to be tested now that we have the capacity? First of all, that's a good problem to have compared to not having the capacity. And it's our job to deploy it the right way and to message it the right way. Right now, I feel pretty good about what's happening. These different community groups are doing a really good job, but we need everybody's help, every local leader, every healthcare official. We need partners in the media to talk about how important testing is. And those in the media, if you haven't, get tested. Be able to talk to everybody about what it's about. It's not comfortable, but at the same time, it is not so uncomfortable that it should be avoided, because this is something that we got to do. Phil.
If a person is contacted by a contact tracer or the health department and they're told to self-isolate or quarantine, what if they refuse?
If somebody is called, asked to self-isolate, and refuses from the local health department, and what we've seen is different local health departments taking different steps in their communities. We've already seen that in some cases. Now, obviously, if the person is positive and refuses to self-quarantine, there's some pretty significant steps there that have been taken in 3 or 4 counties across Kentucky. But, oh my goodness, folks, if you believe that you've been exposed, you got to be willing to do what it takes to protect other people. If you are out there saying we got to open this economy right now, which we're working on and we're doing in a safe, gradual manner, you don't want to be the one that refuses to self-isolate and continues to spread it. Karen.
In Lexington, they completed the list of economic recovery recommendations, and they're going to send that to your office. What's the process for incorporating those into the state guidelines, and when will Lexington see those results?
So Lexington is sending some different requests or suggestions on future guidance. We'll have to review them. I have a call 3 days a week with the mayor of Lexington. We've been working hand in hand, and that's a good relationship, and we want to make sure we're responsive. We review them. Public health reviews them. We look at where the numbers are, and those are lots of different numbers, not just the case numbers. We're watching what's happening with kids, and it's about viewing all that information on the whole and making the best decision that we can. Catherine.
Are there still options to maybe use hotels or have field hospitals if there is a spike?
So the question is, if there is a spike in the coming weeks, are there still options to use hotels or field hospitals? We still have our field hospital intact at the Expo Center in Louisville. It can be operational, we believe, within 24 hours, and that's just a staffing issue, so we are ready there. Our hospitals are also in their phased opening, so right now we do have additional bed capacity, and they're all being very careful about their ventilators and there. But I believe that because we are doing a gradual phased reopening, that if we have a spike, it will not overwhelm our healthcare capacity. And that's one of the reasons that you do it gradually. that if the disease is going to spread, everything hasn't been reopened at previous levels all at once, which means we have the healthcare capacity there to cover it. All right, we are just over an hour. Remember, folks, a lot's happening this week. You're going to have a lot more opportunity to get out there, and I know everybody's been waiting for that. But we need you to do it safely. We need you to do it in moderation. We need you to think through your contacts and make sure that you are keeping them at a low level. Remember, just like flattening the curve, whether or not we can successfully reopen this economy is on us, is on every single one of our actions. So let's do it right. Let's continue to do the work. On Friday, remember, we're going to be able to get together in groups of 10 or less, and we're going to talk all week about how to do that safely. But let's commit to doing it safely. Protect yourself, protect your family, and protect one another. We got a pretty special closing, again, to all of those healthcare heroes that are out there. See you tomorrow at 5.